Right, so the study is called the TARGIT-A randomized trial. This was a trial that compared risk-adapted single-dose intraoperative radiotherapy given during lumpectomy procedure, so immediately after lumpectomy, and that was compared with standard post-operative whole breast radiotherapy given over a course of several days, usually 3 to 6 weeks. So this is the device that is used to give the radiotherapy during the lumpectomy procedure. And this goes inside the breast after the lumpectomy, after the lump is removed, in the cavity that remains behind. And radiation is given over a course of about 30 minutes. And this is the trial was testing whether this can substitute the usual long course of whole breast radiotherapy. So it was testing two things: one, giving a single dose, and second, giving it during the operation, and most importantly, limiting the radiation to only around the primary tumor rather than the whole breast, and therefore avoiding scattered irradiation to the nearby vital organs such as the heart and the lung and the esophagus, where we know the scattered irradiation has been shown to cause harm. So the key results, the primary outcome was non-inferiority in local recurrence at 5 years. And this was proven in our first paper in the Lancet in 2010, the second paper in 2013, and again confirmed with 95% complete follow-up at 5 years in the paper published in the BMJ in 2020. So that was one. The second important part in this latest publication was survival. So what we showed is that what we found was that local recurrence-free survival, that is the chance of living without the cancer coming back, was no different, was the same between giving the radiation during the operation as a single dose in a risk-adapted approach compared with whole breast radiotherapy. Mastectomy-free survival or breast preservation, and this was follow-up up for 12 years, was no different between the two arms. Distant disease-free survival was no different between the two arms of the trial. And mortality from breast cancer was exactly the same with target IORT, that is giving radiation during the lumpectomy procedure, as giving whole breast radiotherapy. But what was remarkable was that deaths from other causes, such as cardiovascular causes, other cancers, and lung problems, were significantly reduced, nearly halved, with a hazard ratio of 0.59. So at 12 years, this difference was 9.85% with external beam radiotherapy, whole breast radiotherapy, and only 5.4% with target IORT given during the lumpectomy procedure. So it was a really big reduction in non-breast cancer mortality. And in the later paper, in the further analysis, we found that this translated into an overall survival benefit of about 4.4% at 12 years for patients who have a grade 1 or grade 2 cancers. So these were the key results, really. There are other results that have been analyzed separately, is that the patient's breast-related quality of life is better with intraoperative radiotherapy using this intrabeam target IORT approach. There is less pain. Patient experience less pain. There is less breast and arm symptoms, and overall improvement in the quality of life. We also found that the cost is significantly lower for the patient, and the social and economic cost is also reduced. Social and environmental cost is also reduced. There is, you would save about 735 miles of travel on average, and a huge reduction in the carbon emissions. So this is very important in the fact that it actually would reduce global warming, because breast cancer is very common and radiotherapy for breast cancer is commonly required. So the way these can impact is this treatment, since the results were first published, have been adopted around the world. So at present, as of 2019, already even before these results were latest results were published, the treatment has been adopted in about 33 countries. There are 260 breast cancer centers around the world who have offered this treatment to their patients. so that the number at that time, this was 2.5 years ago, was about 45,000 patients had this treatment, given the results that were published in 2010 and 2013. And since then, particularly during COVID, where it is so much more convenient for patients when they go to the operation theater for their cancer operation, and at the same time, they have the radiotherapy. So it's finished all in one go. And they don't, in 80% of the times, they don't have to go back for further radiotherapy. So during COVID times, it avoids repeated visits to the hospital and therefore infection. So many centers started using it much more during the COVID as well, during the pandemic. So I expect the numbers would have gone much more than 50,000 patients by now. So this is the impact it has had around the world. And out of the blue, sometime last year, NIHR, National Institute of Health Research of UK, put it up on their webpage, a post that talked about five amazing health breakthroughs, not cancer, health, overall health breakthroughs in the last year. And they listed our research, Target-A IORT for breast cancer, amongst these five. And the other ones, so listed among us simultaneously, was the Oxford COVID vaccine, as well as 2 COVID treatments. So to be listed among in the same list as those, I thought was quite nice.